So for several years now, we have been focusing on things that go deeper than attitude and knowledge and some of the factors that often are routinely measured in these kinds of surveys. So we started with the inclination that perhaps there's something deeper going on. And a good theoretical framework is the moral foundations theory that was developed by a few psychologists and then applied to political science, etc. initially. And what it postulates and it equates and the examples it uses is of our taste buds. So just like we have a distribution of taste buds and that get triggered differentially by different kinds of foods and other stimuli, and a combination of that stimulation and the combination of sensitivity to different foods in a given population give us the unique flavors of the different foods or other stimuli. So those are our actual sort of food-related taste buds. So, but the moral foundations theory postulates that just like or similar to our other food-related taste buds, we have six moral foundations, and that are perhaps universal. However, the way we are sensitive, or the way they're emphasized, varies by different societies. So that's number one. B, it also varies by the stimulus, etc. So what the message is, what the what the communication approach is, so on and so forth. So based on that theory and sort of armed with some of the evidence from another field, we wanted to initially test, like, is there an association between moral foundations and vaccine acceptance behavior? And initially, we did some work in the US. And what we found was that in US parents of children who were eligible for vaccines, there was indeed an association. There was an association with purity foundation of vaccine hesitancy, if they emphasized things like sort of my body is a temple and stuff like that. And then with the Liberty Foundation, their ability to choose. On the other hand, they were less likely to be hesitant if they had an emphasis on authority foundation in the US. Interestingly, in our population of pregnant women in Kenya, again, a reasonably nationally representative sample, what we found was the purity wasn't associated with a woman's inclination to accept, for example, maternal influenza vaccine, and the relationship of authority and liberty was flipped. So if you emphasize more liberty, you were actually more likely to accept influenza vaccine. And if you emphasize authority, if you were less likely to accept influenza vaccine. So that's the nuance by population and how, for example, an individual's moral values perhaps interact with the society, with the health system, with the government, and some of those underlying frameworks.